Hello, my name's Shane Roberts. I'm going to give you a brief rundown of our week 4 assignment with our interviews. I had originally scheduled 5 interviews, but unfortunately I was only able to get to 3, which is probably lucky because I already went a minute over the allotted 7 minutes of maximum time. Please forgive me. I had some very interesting folks. I had three, like I said, 3 individuals. One was Rob. He is our project manager over at CVPH. He's got some good views about the supporting end of the piece because he previously managed the help desk, so some good insight there. Then we have Bob, who is a nuclear technician at the hospital. Vast experience, about 20 years experience from across the country, Florida, New Mexico, New Hampshire. So some good views in that regard on how things are different across our great nation. And also Karen, who I spent most of the time with of the 7 minutes that I had. She's like 14 years as a nurse, and now she's working, training doctors on how to use the EMR. So she's seen it on both sides. A lot of good information from her. So I hope you enjoy it. I know it's a little long, but it's what I could do with my limited editing skills. Thank you. Please tell us a little bit about yourself.
Yeah, I'm the director of the project management office for University of Vermont Medical Center in Plattsburgh. So, been in IT for approximately, health IT for probably about 15 years, and then 6 years in private IT.
Yeah, I know in your past role, you managed the help desk.
Yeah.
What kind of problems did you see from the EHR or EMR side of things coming into the help desk on a regular basis? Was it usability, issues with the systems itself, that sort of thing?
Yeah, it was some usability issues. It could be, there's a lot of interoperability, I think, with other systems. So passwords was probably one of the biggest, complaints is accessibility. I think the GUI and different mediums people are using, from laptops to Zero clients to PCs. Having that kind of same experience holistically, and since you don't, doctors are coming from outside clinics and they come in the hospital. It's how the systems are built, from a clinical EMR to, or I should say like a primary care EMR to our EHR is a little bit different. So having that, not having complete continuity with the way the systems are built, the information that's needed is a little bit different.
So you feel like a standard template of sorts would definitely benefit?
Yeah, absolutely. Well, it's unfortunate because the outside, the inpatient world is different than the outpatient world, and it's governed differently. And then you got Medicare and Medicaid that have different requirements. So it's a different, and the systems are tailored to those individual organizations, right? Patients or otherwise. So it can be challenging.
Before we do that, can you tell us a little bit about yourself?
Yes, my name is Bob. I'm a nuclear medicine technologist here at CVPH. This has been my career for about 20 years. I have worked at a number of different facilities. I've worked at, most have been community hospitals of about this size, which is 300 beds.
Roughly 300
Okay.
to 350 or something to that effect.
Okay, so I guess 3 facilities in 3 different states about this, and also a private cardiology practice. And the practice in my field has been about the same in all facilities.
Okay, I was just about to ask you, like, what have you seen differently as far as EMR practices or health information technology across those different facilities by state, or what were some major differences, if there were any, between a private practice and a larger facility like this?
Oh, that was a good question. In a large facility, between these states, in my experience, New Mexico, New Hampshire, and New York, and Florida, where I trained, big facilities have a pretty good control over their privacy. Over 20 years, it's been a concern. It's, of course, of the utmost concern now. But in the private practice, people were surprisingly loose-lipped And even though most had hospital experience while working there.
Does your provider have a patient portal? And do you use it if it's available?
I don't have access here, but in other facilities, for a lot of my life, a good deal of my adult life as a patient, I have used the patient portal service, and it was very convenient. The only limitation was my acceptance of it. And so I had to change my mindset to make that a part of my healthcare. And once I did, I found it to be very helpful.
Hello, Karen. Thank you for coming in today and allowing me to interview you. I know you're very busy, so I appreciate your time. Can you please tell us a little bit about yourself?
Okay, so I have a history of about 14 years of nursing, for which I would say 13 of them I use the electronic health record. I am currently a nurse clinical analyst and working more with on the EMR side of things versus directly with patients.
If you can answer both sides of this question,
Okay.
what do you think of electronic medical records? If you can answer the first part as a nurse, how did you like them, or how did you, use them, and what did you feel about them?
Yep. I like the accessibility of information amongst clinics. I appreciated the speed at which I could document, but also having access to other information that helped me to complete my documentation in the moment. I found that it is helpful for patients' medications, making sure that their medication list is up to date. I think this is an issue with patient safety, but I feel that prior to that, I feel people were working on a medication list that was even more incorrect. So even though there's still ways to improve patient safety when it comes to medications, I think the EMR has helped a lot in improving that. From the other side, when it comes to working within the EMR and the functionality of the EMR, and when it comes to the encounters that are created for the providers to perform their documentation, the one thing that I think could be made a little bit better is the number of clicks that a provider has to do in order to complete their documentation. Also, maybe the structure of the documents, as I find that as we read as individuals, we start at the top of the page and we work our way down, but I've seen some forms where it seems like it's scattered all over the place, where first they're up at the top of the form, then they're over to the right, then the bottom, then back up to the top. So I think that the functionality of the forms too could be improved.
Do you think the HITECH Act and meaningful use has helped bridge that gap to a certain extent?
Actually, I probably think it's made it harder
Really?
for them. Yeah.
Wow.
It's been my experience that some of the private offices, it really comes down to the maybe the income that they have that's accessible to them at that particular time. But I know that there's some providers that are just willing to take the hit and willing to pay the penalties because it's still going to be cheaper than it is for them to try to catch up.
Wow.
Yeah.
So do you think the meaningful use steps are too aggressive at this point?
Yeah, I would say too aggressive, especially for a lot of the private providers.
Okay.